Hi, my name is Michael Baddour, and I'm an otolaryngology physician at Emory Healthcare, specializing in head and neck reconstructive surgery as well as the treatment of facial paralysis. I grew up in a medical household in a small town in Tennessee. My mom was a nurse and my dad was an oral surgeon. I saw the relationship my father was able to develop with his patients and how much joy it brought him as well as his patients. And I knew that I wanted to invest my life in medicine as well. So I went to med school at the University of Tennessee Health Science Center and completed my residency and fellowship here at Emory University School of Medicine. I'm privileged to work with my head and neck surgical colleagues performing reconstructive surgeries to restore form and function following surgical treatment for tumors of the head and neck and other causes. I also have a special interest in treating patients suffering from all forms of facial paralysis. In terms of my reconstructive practice at Winship Cancer Institute, we have a full complement of resources in terms of specialties and support services to engage our patients on their journey before, during, and after their treatment. We have someone to support them every step of the way. Availability and access to clinical trials and the most advanced surgical techniques allows us to offer the patients the most up-to-date treatment options, which I believe sets Winship apart. At the Emory Facial Nerve Center, we see patients afflicted with facial paralysis from a variety of different causes, such as Bell's palsy, Ramsay-Hunt syndrome, head and neck cancers, acoustic neuromas, and many other causes. We're the largest program for facial paralysis care in Georgia and one of the only centers in the Southeast. In addition to surgical treatments we offer for facial paralysis, we also have a very busy medical Botox practice for assisting our patients with symmetry and function. As I'm caring for my patients, I always want to communicate with them that we are a team. I'll be there to walk them through their entire treatment process. You may have heard the phrase, where science becomes hope. To me, that means that our basic science and clinical research programs, we are continuously striving to improve patient outcomes and provide the most up-to-date evidence-based care. When I'm not at work, I enjoy spending time with my family more than anything else. I'm an amateur, now addicted tennis player that plays mediocre tennis, and my favorite thing to do in the world is to fish, especially at some of my fishing holes back in Tennessee and in coastal areas. I'll go fishing anytime, anywhere with anybody. In closing, I look forward to meeting you and starting our healthcare journey together at Emory.